Hello, how's it going? Okay, well, I will do a little photo shoot while you decide if you're gonna be excited that I'm here. Can you take a picture of me? Yeah, we're gonna do that because I'm gonna celebrate myself, that's what I do, so. I'm pretend talking. Thank you. Well, thank you. All right, well, I don't like being bored. It's not my thing. So that's why I got a whole bunch of degrees, so I can come to places like this and keep you entertained. So if I'm boring you at any moment in time, just like put your hand up or yell at me or something, because I don't want to waste your time and I don't want to waste mine. Does that sound good? Yep. Okay, awesome, great. So I'm Akilah. Why is this? Oh, there we go. The agenda today, we're going to talk about my EDS journey, the importance of health equity and EDS, and ways to take action for your systems, okay? Why am I showing you this? Because I'm a big deal. So I'm the founder and CEO of Change Cadet, and I've worked with all these brands or continually work with them or worked with the past or whatever. I've done something that you do every day in your life, I've had an impact on. My company has had an impact on. I stay busy, as you can see here. Change Cadet is an organizational development consulting firm. We're focused on creating cultures of belonging. We do that with crisis management, strategy change, executive coaching. We do workshops. We also are creative, so we'll do marketing, branding, storytelling. And I have a lot of titles and a lot of hats. I'm a founder CEO. I'm an author. My book comes out in February, which I'm really excited about. That's when you clap. Now, I'll be saying things like this because it's important to celebrate ourselves for those of us who are doing this work and those of us who live with Ehlers-Danlos syndrome. My book that comes out in February next year is called White Supremacy is All Around. And it talks about how white supremacy is all around, notes from a Black disabled woman and a white world. When the cover comes out to be revealed, I'm proudly on the cover holding a cane because sometimes I have visible disability and sometimes I have invisible disability. And white supremacy is one of the reasons why we have this conference, why doctors don't diagnose us, why people may not believe our pain. And I talk about it in the book. I model, I'm a stylist. Obviously talking to you as a speaker. What else do I do? I produce storytelling, so I produce documentaries and shorts. I'm producing my first play. I'm a partner of the soccer team or football team, because I'm from Oakland, California. The Oakland women's and men's soccer team, I'm a partner there. I am a creative director of a record label, and I'm a fractional chief marketing officer of a tech startup that was funded by an up-and-coming artist named Jay-Z. So I do, I think he's gonna make it. So I do lots of things. Now, I don't share this to be boastful. I share this because wherever I am, I'm an act of resistance. Wherever I am, I'm educating people on how to work with someone with disability. And wherever I am, I'm changing the stereotype of what disability looks like. All right. My EDS journey, this is probably what you care about the most. I started having heart issues in 2016 on a flight to London. I've been to London several times, didn't understand why I was having heart symptoms. I was later diagnosed with coronary artery spasms, but it took about 1.5 years to be diagnosed with that. Coronary artery spasms are essentially, just means my body thinks it's having a heart attack every day. So I live with the symptoms of a heart attack. Shortness of breath, pain in my left arm, pain in my chest, or anywhere in my chest cavity, I can have pain. It also means I get to live with the risk of death every day. Yes, oh my God, I'm glad you're so excited about that. See, this is why I give none of the and I just do what I do, because I can die at any moment in time. None of the is a technical term because I'm a doctor. So from there, that turned into leg pain. So I was having pain on my left side, and they're like, well, maybe it has something to do with your heart, but it didn't. Fast forward through lots of doctors and tests, I learned about EDS. And I was like, this is for white people. This has nothing to do with me. My skin does not stretch. Like, this can't be it. This doesn't make any sense. Can I have some of the symptoms? Sure, but it couldn't be for me because I didn't see people who had it. I didn't find research for those who have it. Now, to break things down for you, I have an undergrad in health science, community-based public health. I have a master's in public health, and I have a doctorate in health science and leadership and organizational behavior that I got from a med school, a DO med school. So I'm smart AF. So I did my research, and the research didn't show that someone like me could have that thing. So the journey continued, neurologist, maybe I have neuropathy, like going through all of these things. And soon enough, I realized by doing further research that there was a scale, this Beighton scale that I could do. And so my primary doctor, who's a doctor of osteopathy, they're my favorite doctors. DOs are great. If there are any DOs in the room, thank you. We did the scale, and I passed with flying colors. A+. And as a Virgo, I was really happy that I succeeded. So I was like, oh, I have this thing. And so I continued on my journey, and I did what I was supposed to do. Again, I mentioned earlier, I live in Oakland, California, United States of America. That's right now, but I live there, and I have my care at the University of California, San Francisco, or UCSF. It's a leading organization. So I did what I was supposed to do. I waited in line to go to genetics testing to see the one of two geneticists that are at UCSF. I was told I had to see this doctor and then get this note and do this thing. And even though with flying colors in the Beighton scale, I didn't get in. It took a year for someone to say, okay, you can have an appointment. Now, as I've already shared with you, I'm a Virgo. So I learned that I could do my own genetics testing. There's so many, I'm in Silicon Valley. There's biotech, tech labs, labs galore. So I did my own genetics testing, and I realized that I have this special gene that makes me, does anyone want to guess what of the 13 types of EDS I have? Just throw it out there. Yes, yeah, good job. I have myopathic, Ehlers-Danlos syndrome. You can also clap for that too. The reason why I bring that up is that I learned that the type I have is even more rare than other types. So where was I going? Where would I be seen? What could I find? Because so many things are hypermobile, Ehlers-Danlos syndrome, classical, vascular, but there's not a lot on myopathic. I'm like, Beth, what? What do I have, right? So in true fashion, I was diagnosed with Ehlers-Danlos syndrome in May, which made for a wonderful Instagram post because it's EDS Awareness Month. So that worked out really well. What didn't work out well is that it's also when I was closing on my multi-level home that I was able to buy due to white supremacy and the murder of George Floyd in America. My business was incredibly successful. I finally was able to buy a home, but everything had to do with steps. And my home was upside down. And what I thought was just aches and pains of just injuries from either playing sports or, I don't know, maybe being older was something I would have for the rest of my life. And so in that very month of May, I had the joy of a diagnosis, the bittersweet notion of being a homeowner, realizing that I had to save again for a single-story home in the San Francisco Bay Area, which is really hard to do, so I can have a place to live. But then also, I have a rarer type of EDS, and I already knew it'd be a struggle being diagnosed with EDS because I don't see people like me, and there isn't data that's out there like me. So my journey with EDS continues because I live with it every day. I don't know about you guys, but I like to go to the emergency room to try to find my husband. Has not worked out. But I was there last week just because I had complications from an endoscopy, and I had to get checked out to make sure I could fly here and be with all of you today. But anytime I'm in the ER, I apparently am a cat. So thank you, Dr. Halverson. I have clinician trauma, so I get the following when a Black disabled woman goes to the emergency room with a chart that says I have Ehlers-Danlos syndrome and coronary artery spasms and orthostatic hypotension and preatrial contractions, inappropriate sinus tachycardia. Shall I go on? I go, and I'm never believed. So think about it. Sometimes you feel like you're dying or you're in an immense amount of pain, and then you go to an emergency room and no one believes you. Or they ask you oh, you must be stressed. You must be anxious. Are you looking for drugs? Are you scared? Every single time that happens, we don't know what's wrong with you. Or yeah, you have pain, but we're just gonna send you home because we don't know. Now, I know my patient rights, and so if you're at a certain number on a scale, you have to be treated for pain. There's been times where I've been sent home where they'll say, yeah, you can go home, we don't know what's wrong with you. And I'm like, okay, but I'm a 7 or 8 on the pain scale. What are you gonna do for my pain? What do you want? This is a husband, but that's not gonna happen. So sometimes I'll offer Vicodin, and then I'll show my wristband that shows that I'm allergic to Vicodin. I'm literally not seen over and over and over and over again. So I've learned to extend a doctor's note, and my cardiologist knows it takes me an hour, trauma. It takes me an hour to go to the emergency room that's less than 10 minutes away. I have to prepare myself emotionally. I put my little bag together. I figure out what Beyonce shirt I'm gonna wear so I feel that I have some support there. Anyone excited about the Renaissance tour? Did you go already? Was it great? I'm going on September 2nd, my birthday, which is 2 days before Beyonce's. But last, I have to do something that I hate immensely, which is say, I'm a doctor too. And that's because I knew when I got my doctorate at 33 that people would have to believe me. If they were racist, they would still have to call me Dr. Cadet, which I love. But I could be in a situation where I can advocate for myself. As I mentioned, I have 3 degrees, and people don't believe me. A colleague, I went to med school, and they still don't believe me. So imagine what that lens is like when you have rare disease and you're not believed. It makes you invisible. So what needs to be done? Well, we have to talk about health equity. So the Centers for Disease Control and Prevention, they say that in a state in which everyone has fair and just opportunity to attain their highest level, that is health equity. But for me, it means that I'm seen, I'm believed, and I'm treated with value. When looking at this technical term called Black person EDS, so if you use Google as a search engine to say Black person with EDS, these are the things that come up. So Adrienne was interviewed and asked one question: tell me what kind of biases you've experienced yourself. How has being a Black woman affected your EDS journey? She said, my journey really was and is bittersweet. I get a lot of people telling me, thank you for sharing your story, you're encouraging. But then I talk to people in the disability community that don't feel like a Black person should even have EDS. I've had people tell me that I couldn't have EDS because it's only a white person's disease. Right? Yeah, again, technical terms. So there's people who have EDS, have something that's rare. We're on, NORD, we're everywhere, we're rare. But there's a group of people that have a rare disease called being Black. That's not a joke. That's a reality. Right? I appreciate the laughter, but it's a reality. So what can be done? So we think about taking action. We have to acknowledge historical and contemporary injustices to patients of color. So in America, we say BIPOC, Black, Indigenous people of color. Internationally, we say people of color. But we're talking about non-white people and their experience with Ehlers-Danlos syndrome, because we do exist, and we're out there. In America particularly, we have a history of enslavement and genocide. When we talk about enslavement, there are doctors still to this day who believe that Black people can experience more pain. They have a higher tolerance for pain. Doctors believe that we can have 2 times as much pain as a white person. That intensifies when we think about maternal health and how much pain a birthing person can take on. Doctors believe that Black people literally have thicker skin. And do you want to know where this comes from? America's wonderful history with enslavement of Black people. In order to justify maiming, murdering, and harm of Black people, white people had to say they could take this. And those same people built our med schools. Those same people have a legacy. And those same people are treating me where I don't feel valued, seen, or heard, and my pain's not believed. We've already heard a lot today. This is the first day of pain being believed, right? Looking around the room, whose pain was believed. My pain is really not believed. We have to look at the history of oppression of people of color in whatever country you're in. There are castes, there's systems, there's structures. And we also have to realize that white men, some of you are beautiful men, I will just put that out there, but you are the primary research subjects. So that leaves women out of the equation. So if we want to take action, we have to dismantle oppressive economic, social structures, systems, and obstacles to overcome health and healthcare. So if you're a patient, this is for you. You have to be very mindful of your intersectionality. So what is intersectionality? It's a term coined by Kimberly Crenshaw in the US, and it means the different parts of our identities. So if you think about a bus full of people going down a street and there's an intersection, let's say that first bus is low income. So if you have low income, you have to get off the bus. Maybe that next intersection is LGBT plus folks, you have to get off the bus. And then the next intersection could be Black people. But what are the points of your intersectionality? Because if that bus makes it down the street, it most likely is gonna have heterosexual, cisgendered, non-disabled, white, privileged men on it at the end of that bus, right? So what are the points of our intersectionality? You heard in my bio, I'm described as a Black disabled woman. I'm a Black person. I am a woman. I am disabled. I also have major depressive disorder. Yeah, right? So fun. It's exciting. That's why I have a sense of humor. But you know, we have these different parts of our intersectionality. So as patients, it's really important you understand what your intersectionality is, so you know how you're going to be viewed in that healthcare setting, in that medical setting. So you can know how to advocate for yourself. Now, it's not great that we have to advocate for ourselves. So again, as I mentioned, I'm pretty smart. My name also means intelligent girl who reasons, so there's that too. But even with all the intelligence that I have, I'm still viewed, right, as less than in certain places because of power, structures, and systems. So I have to be mindful of that. I also am mindful of the fact that even with all that experience, and I have a horrible treatment of care, there's people who have a fraction of that experience. So if I have all the skill set to be my best patient advocate, there's people out there who don't have that. So one way that you can work on that is understanding your intersectionality. Know your patient's rights too. Whatever country you're in, know your patient's rights. Ask your provider to notate refusals in their chart, because they hate that. But I love it, right? It's important because as you have to go from doctor to doctor to doctor, let them paint that history that's in there. It's a way to hold them accountable too. You should also have a provider that checks their bias at the door. If they don't, find another one. It sucks. I've cried having to wait for appointments. I've cried having to find another provider, but don't do that. Don't be afraid to also provide some EDS resources ahead of time. I know that feels like additional work, but I cannot tell you how many times people are like, what is that again? When I had my endoscopy last week, the nurse freaked out because she didn't know what EDS was. My blood pressure is low and like I have orthostatic hypertension. Okay, but what else, what does this mean? And what about your heart? And all of these things. She literally freaked out. And I was like, chill. This is my gastroenterologist, we're good. This is like my 4th or 5th procedure with her, we're fine. Yeah, but I don't know what it is. I said, but I do. and so does my doctor. Do you know she left and gave me another nurse, which I loved? I thought it was great, because if she was freaking out, I didn't necessarily want her around, right? But that's a common thing when people are like, what do you have? I know in this room, it's normal to have a doctor say, what do you have? But it doesn't mean it doesn't hurt. It doesn't mean that it isn't frustrating when they don't know what it is. It doesn't mean it's not frustrating when they don't look at your chart to take the time to at least go to the EDS Society and look it up, or do anything Google says that gives you an advantage of what this is. For providers, check your bias at the door. The providers in this room, check your bias at the door. You don't know everything. I don't know everything. We all don't know what we don't know. And so it's okay to ask questions. It's okay to say, I'll get back to you. It's okay to say, I'm gonna look into more resources or research to get back to that patient. You don't have to be right in the moment. Understand that there's limited EDS research to begin with, and that could be the barrier as to why you don't necessarily know, or why you may be defensive, or why you choose to medically gaslight individuals. Realize that doing the test is important, because EDS is still a diagnosis of elimination. Not all of us have access to genetics testing, or like I shared earlier, there can be a backlog. For the system in general, we have to change medical education. This shouldn't be rare. Dr. Halverson had rare-ish, because maybe there's a little bit of upward mobility, but this thing shouldn't be rare. There's lots of people who, no disease should be rare. It's a choice. So we have to change medical education so there can be more understanding and compassion, so people can not only learn about EDS, but be willing to learn from their patient. You have to, the system needs to understand bias, stereotyping. We have to have more diverse providers, from experience, identity, intersectionality. We need more inclusive research to be out there. Like I said, I didn't know Black people could have EDS. But in general, we have to be believed. Our symptoms need to be believed. Taking action for the Ehlers-Danlos Society, while we're all here today, it's looking at funding, research, those resources for funding. I don't know what's happening specifically for people of color. I don't necessarily know what studies are done by the EDS Society for Black people. There's lots of stories of representation of inclusiveness for people with different lived experience, but where's the specific funding to address the fact that myself and other Black people or other people of color have Ehlers-Danlos syndrome? It's making sure there's continuing partners that can help with diversifying what's needed for this wonderful global organization. And it's making sure the actions and words match with the diversity inclusion statement. Does everyone know what the diversity inclusion statement is for the EDS Society? No, okay. Well, it's on the website. Take the time to read it and ask yourself, what are you doing in that work to continue the work of the EDS Society? It's also realizing that the board doesn't represent me. There's 10 people on the board and 1 person of color. And this is just off of observation. So the very society that's representing EDS doesn't necessarily represent me. And I'm not saying this as EDS is bad. In order to do this work, we have to call people in to action and accountability. I look forward to what the EDS Society is going to do to make sure they are committed to dismantling inequity and equality. I'm happy to be a part of that if I'm needed. But we have to realize the very systems and structures that are out there exclude people who aren't white. And so I want to challenge you all to continually do that work. We must change the structures, the systems, and policies that continue generational patterns of injustice for communities of color in order to change attitudes, behaviors, and actions of providers and healthcare systems. I hope all of you realize that you, no matter how you identify, can be part of that change that's needed. So for the next Black person who realizes they have an ache or pain or that their thumb shouldn't do this, they can see themselves and they can know that they can get treatment and be seen sooner than later. Healthcare may not see me, but I make sure that I am seen because I'm extra AF, as you can see here, and what I've shared with you today. Thank you.